Today we're talking about something you absolutely need to know, something that could be quietly damaging the hearts of older adults everywhere. And it's not a mystery disease, it's a pill that millions take without realizing the hidden risks. Now look, I'm not here to scare you, I'm here to educate you so you can take control of your health with clarity and confidence. Many older adults, people in their 60s, 70s, even 80s, are prescribed medications for pain, inflammation, or other chronic symptoms. Some of these drugs do help people feel better in the short term, but emerging evidence shows that long-term use of certain medications can harm the heart. Here's the deal. Some commonly prescribed drugs, especially certain pain relievers and anti-inflammatory medications, can increase the risk of high blood pressure, fluid retention, and harmful stress on the heart muscle over time. In older adults, the heart is already working harder. With age, blood vessels can stiffen, blood pressure can rise, and the heart can become more sensitive to stress. Add a medication that increases fluid retention or affects blood pressure, and you may be putting your heart at risk without knowing it. Many older adults take pills every single day, believing they are completely safe simply because they were prescribed by a doctor or purchased over the counter. And while many medications can be helpful and even life-saving, there is an uncomfortable truth that needs to be talked about more openly. Some very common pills, especially those used for pain and inflammation, can silently damage the heart over time, particularly in older adults. The danger is not usually immediate. That's what makes it so concerning. These medications don't cause sudden pain in the chest or instant warning signs. Instead, they work quietly in the background, slowly creating conditions that place extra stress on the cardiovascular system. One of the biggest issues is blood pressure. Certain commonly used pills can cause blood pressure to rise gradually. Now, a younger person may tolerate this increase without obvious symptoms, but in older adults whose blood vessels are already less flexible and more prone to stiffness, even a small rise in blood pressure can significantly increase the workload on the heart. Over time, the heart has to pump harder just to move blood through the body, and that constant strain weakens it. Another serious concern is fluid retention. Some medications cause the body to hold on to excess fluid. That fluid doesn't just sit harmlessly, it increases blood volume. More blood volume means more pressure inside the blood vessels, and that again forces the heart to work harder. In older adults, this can contribute to swelling in the legs, shortness of breath, and eventually heart failure if left unchecked. What makes this even more dangerous is that many seniors assume these symptoms are just part of getting older. They think, of course my ankles swell, I'm aging, or of course I get tired easily, that's normal. But in many cases, these changes are not normal aging at all. They can be subtle warning signs that the heart is under stress, stress that may be coming from a pill taken every day. Certain medications can also interfere with kidney function, which plays a critical role in regulating blood pressure and fluid balance. When the kidneys are affected, sodium and water can build up in the body, further increasing strain on the heart. In older adults, kidney function naturally declines with age, so adding a medication that burdens the kidneys creates a perfect storm for cardiovascular damage. Here's another problem. Many of these pills are taken long term. A short course may not be harmful, but years of daily use is a completely different story. The heart doesn't complain loudly at first. It adapts, it compensates. But compensation has limits. Eventually, that constant extra effort leads to thickening of the heart muscle, reduced efficiency, and higher risk of serious cardiac events. What's especially troubling is that many of these medications are taken for symptom relief, not because they cure an underlying condition. Pain is reduced, inflammation feels better, but the root cause may remain while the heart quietly pays the price. And let me be very clear here, this does not mean that every pill is dangerous, and it does not mean that medication should be feared. The problem is blind trust without understanding. Too many older adults take pills without ever being told how they might affect the heart over time. Too many assume that if it's common, it must be safe. Safety is not just about today, it's about what happens to your body 5, 10, or 15 years down the road. The heart is not designed to be overworked day after day. It already beats over 100,000 times a day nonstop without rest. When medications raise blood pressure, increase fluid load, or disrupt natural balance in the body, the heart is forced to push harder with every beat. That kind of chronic strain accelerates aging of the cardiovascular system. Another overlooked issue is drug stacking. Many older adults take multiple medications at once. One pill may slightly raise blood pressure. Another may cause fluid retention. A third may affect kidney function. Individually, each effect seems small. Together, they can significantly increase heart risk, and often no one connects the dots. This is why education is so important. When people understand how certain pills affect the heart, they can have informed conversations with their healthcare providers. They can ask better questions. They can explore safer alternatives. They can monitor warning signs early instead of reacting after damage has already occurred. The most dangerous pill is not always the strongest one. It's the one taken without awareness. Your heart supports every breath you take, every step you walk, every moment you live. Protecting it requires more than just good intentions. It requires understanding how everyday choices, including the pills you take, affect it over time. Awareness doesn't create fear, it creates power. And when older adults are empowered with the right information, they can make choices that support not just symptom relief, but long-term heart health, energy, and independence. One of the most important messages I want you to hear and really take to heart is this: never stop a medication abruptly, especially as an older adult. At the same time, never assume that staying on a medication forever without question is the safest choice either. The truth lies in the middle, and that truth is called informed decision making. Too often people hear that a pill may have risks and they panic. They stop it suddenly, they throw it away, and that can be dangerous. Certain medications affect blood pressure, heart rhythm, hormones, inflammation, or the nervous system. Stopping them suddenly can shock the body, stress the heart, and create serious complications. The body adapts to what you take regularly. When something is removed abruptly, the system can become unstable. That's why fear is never the solution. Awareness is. Medications are powerful. They change how the body functions. Some slow things down, some speed things up, some alter chemistry in ways you don't feel right away. When you take something daily, your body learns to live with it. That's why any change, especially stopping, must be done carefully and intelligently with professional guidance. Now here's where many older adults go wrong. They either trust blindly or they rebel completely. Neither approach protects your heart. Blind trust sounds like this: the doctor gave it to me, so it must be safe. Total rebellion sounds like this: I heard pills are bad, so I sit and stopping everything. Both can cause harm. The smarter approach is to become an active participant in your health. That means asking questions. That means understanding why you're taking a medication, what it does, what the risks are, and whether there are safer options for your current age and condition. Every older adult should know the purpose of each pill they take. If you can't explain it in simple terms, that's a sign you need more information. You have every right to ask your doctor or pharmacist questions. This is your body. This is your heart. Ask things like, how does this medication affect my blood pressure? Does it cause fluid retention? Does it stress my heart or kidneys over time? Is this still appropriate for me at my age? Are there safer alternatives or lower doses? These are not confrontational questions, they are responsible ones. Another important point is dosage and duration. Many medications are prescribed for short-term relief but end up being taken for years. The longer a medication is taken, the more important it becomes to reevaluate its impact, especially on the heart. What was once helpful may no longer be necessary, or the risks may now outweigh the benefits. This is where gradual adjustment comes in. If a medication needs to be reduced or discontinued, it is often done slowly. This allows the body to adapt safely. It gives the heart time to adjust. It reduces withdrawal effects and avoids sudden stress on the cardiovascular system. There is also a powerful role for monitoring. When changes are made intelligently, doctors can monitor blood pressure, heart rate, swelling, kidney function, and energy levels. These markers tell a story. They help determine whether a medication is helping or harming. Without monitoring, decisions are guesses. With monitoring, they are informed choices. Many older adults are surprised to learn that some symptoms they've accepted for years may actually be medication side effects. Fatigue, dizziness, swelling, shortness of breath, brain fog. These are often blamed on aging, but sometimes they improve when medications are adjusted properly. This is not about rejecting modern medicine, it's about using it wisely. Another key element is individualization. There is no one-size-fits-all approach, especially after 60. Two people can take the same pill and have very different reactions. Age, weight, kidney function, heart health, and other medications all matter. That's why regular review of medications is so important for older adults. Your health today is not the same as it was 10 years ago. Your medication plan shouldn't be either. And let me say this clearly, advocating for yourself does not mean being difficult. It means being informed. It means respecting your body enough to want the best for it. Doctors appreciate patients who are engaged and thoughtful. Pharmacists are an incredible resource and are often underused when it comes to understanding medication risks. When older adults take ownership of their medication decisions, something powerful happens. Fear fades. Confusion fades, confidence grows, you move from being passive to empowered. The heart thrives on balance. Sudden extremes, sudden stopping, sudden changes, sudden stress, challenge it. Thoughtful, gradual, informed choices, protect it. The goal is not to live without medicine. The goal is to live well with clarity, safety, and strength. Your heart has carried you through decades of life. It deserves respect, patience, and intelligent care, and that begins with understanding, not fear, and action, not silence. One of the greatest advantages you can give yourself as you age is early awareness, not fear, not worry. Awareness. Because when you understand what is happening inside your body before a crisis occurs, you gain the ability to protect your heart, your strength, and your independence for years to come. Too many people wait till damage is already done. The goal is to act before the warning signs turn into serious problems. The heart is incredibly resilient, but it responds best when stress is reduced early. When strain continues unnoticed for months or years, the heart adapts in ways that are not always healthy. Muscles thicken, blood pressure rises, efficiency declines. By the time symptoms become obvious, the heart has already been working too hard for too long. Early awareness changes that timeline. When older adults learn how medications, lifestyle habits, and daily choices affect the heart, they are able to intervene sooner. A small adjustment made early, whether it's reviewing a medication, lowering a dose, changing timing, or addressing side effects, can prevent years of unnecessary strain. This is not dramatic medicine. This is intelligent prevention. One of the most powerful benefits of early awareness is energy preservation. Many seniors believe fatigue is simply part of aging. They accept low energy, shortness of breath, and weakness as unavoidable. But often these are signs of a heart that is being overworked. When stress on the heart is reduced early, energy often improves. Walking becomes easier. Recovery becomes faster. Daily activities feel lighter instead of exhausting. Early awareness also protects mobility. The heart supplies oxygen to every muscle. When circulation is compromised or the heart is strained, muscles fatigue faster and recover more slowly. This contributes to weakness, poor balance, and loss of independence. Protecting heart function early helps preserve strength, stability, and confidence in movement. Another critical benefit is quality of life. Health is not just about living longer, it's about living better. A heart that functions efficiently supports clearer thinking, better sleep, improved mood, and greater resilience to stress. Many people are surprised to discover how much their emotional and mental well-being improves when cardiovascular strain is reduced. Early awareness also helps prevent the cascade effect. One problem often leads to another. Heart strain can worsen kidney function. Poor kidney function can increase blood pressure. Elevated blood pressure further stresses the heart. When this cycle is identified early, it can be interrupted. When it is ignored, it accelerates. This is why routine monitoring matters. Paying attention to blood pressure trends, swelling, breathing, and exercise tolerance provides valuable information. These signals are the body's way of communicating. When you listen early, you can respond gently. When you ignore them, the body is forced to speak louder, often through illness or hospitalization. Another important aspect of early awareness is choice. When you catch issues early, you have more options. You can make small changes instead of drastic ones. You can adjust rather than overhaul. You can prevent instead of repair. This preserves not only health but peace of mind. Many older adults also experience improved confidence when they understand their heart health. Fear comes from uncertainty. Knowledge replaces fear with calm control. When you know what supports your heart and what challenges it, decisions become easier. You stop guessing, you stop worrying, you act with purpose. Early awareness also supports longevity, but not in the way most people think. It's not about chasing numbers or obsessing over every symptom. It's about maintaining balance. A heart that is protected early remains more adaptable later. It handles stress better. It recovers faster. It supports a longer, more active life. Another overlooked benefit is independence. Loss of heart health often leads to loss of independence. Fatigue limits activity. Shortness of breath limits mobility. Weakness increases reliance on others. Protecting the heart early helps maintain self-sufficiency, the ability to move, think, and live on your own terms. What's powerful about early awareness is that it does not require extreme measures. It requires attention, it requires curiosity, it requires respect for your body's signals, it requires regular conversations with healthcare providers and honest reflection on how you feel day to day. Aging does not mean surrender and control. It means becoming wiser in how you care for yourself. Early awareness is wisdom in action. Your heart has been beating since before you were born and is adapted to stress, change, and challenge for decades. When you support it early, it continues to support you, quietly, faithfully, and powerfully. Protecting heart health is not a single decision. It is a series of small, informed choices made over time. And when those choices are made early, they preserve not just life, but the quality of that life.